So this afternoon, I'm just going to talk a little bit about mental health and concurrent disorders in youth. So just a brief overview. Some challenges that we see family face that come into our clinic, and just some general tips in terms of supporting families. And when we say families, I should preface it to say families is really who the youth make it to be. So, and I think particularly when we're looking at new settlers, it can't be that traditional nuclear family. We have to think more broadly. So whether it's extended, aunts and uncles and those kinds of things. So, whoever the youth feels, that's their support system. So, that's sort of when I refer to families who I'm talking about. So why is concurrent disorders important? So concurrent disorders is important because I should start by defining. So we know, Health Canada's definition of a concurrent disorder is basically the combination of a mental health and substance use issue that impacts an individual at the same time. And this is important for us to know because according to the latest, if there's a survey, I don't know, some of you might already be familiar with it. It's the Ontario Student Drug Use and Health Survey, and it's done every 2 years in all high schools across Ontario. So according to the latest stat that came out of that, which I believe this is from 2013, we saw that 45% of youth are reporting one or more of the following symptoms there. So some sort of psychological distress, so whether they're reporting anxiety symptoms, depression symptoms, or just general social dysfunctioning, antisocial behavior, problematic drinking, and some sort of substance use or experimenting with substance use. This is also supported by the GAIN short screener, which was done through Dr. Joanna Henderson and Gloria Heim, and they had, across Canada, they had gotten, I think, 8 community agencies over the last couple of years, and their results that came back was very similar, actually. So 41% of youth reported a concurrent issue, so substance use and mental health. So why is this important for us? Because it's likely for all of us who work on the front line, we're bound to see a youth who's showing up that has a concurrent issue. Because we know co-occurrence is more common than we think. We also know that, focusing on a single issue is not necessarily the most effective because we know substance use can mimic, it can mask or it can worsen mental health symptoms. We know that there's a lot of stats, right, around the effectiveness of early intervention, right? So the earlier that we can intervene and treat, we know that we can decrease severity of issues, we can decrease onset of other problematic issues. And then we also know that youth with concurrent disorders, they put them at higher risk for several issues, right? So from homelessness, to poor health outcomes, rehospitalizations. So we know that they're at a higher risk category. And I think, this is especially true for new settlers who are experiencing concurrent issues. So in addition with all of the other barriers like language and things like that they're facing with, it tends to put them in a higher category of risk. So some warning signs. So if a youth shows up and these are some of the things that they're identifying. So whether a change in sleep and eating patterns, change in mood, inability to function, whether school or work, loss of interest in activities. So they're no longer participating in the hobbies that they once enjoyed. Change in social network, we often hear from parents quite a bit, their friends have changed, right? So they're no longer hanging out with the friends that they grew up with, but they've got a new group of friends now. Social isolation or withdrawing from social gatherings, right? So, they're not participating in family functions anymore. Or socializing with friends and things like that. So lots of conflict within the family, change in finances, secrecy. So these are some of the red flags that might indicate that there might be more going on for that youth. And often a lot of these symptoms, we don't tend to hear these from the youth. What we're hearing, these is from family members, right? So family members are the one calling us and saying to us these are the things that they're observing about their child. So some challenges in families, I think this is going to kind of dovetail nicely into some of what Vince talked about earlier. So we see, very similar things as Vince shared earlier. So things like sadness and loss. We know that, often families, I hear a lot of parents say to me, he's not the same child as he was when he was, in grade 9, right? Like they see a real shift in personality of the child. They worry about other siblings in the home, and Vince talked a little bit about this. So, particularly if they're younger children. So the idea that, the problem child, quote unquote, tends to take up a lot of the resources in the home or the family's attention. We also know things like, they worry about fear, right? So their anxiety and fear about the child's future, and Vince talked about this nicely in his presentation, right? So all of the dreams that they have for that child and what's going to happen to their future. Things like guilt and shame, associated with stigma. And Vince again talked about, like, for many of us who come from various cultural backgrounds, how mental health is viewed in families. So, that adds a layer of complexities in terms of identifying, symptoms. And, this often can lead to family feeling isolated themselves, withdrawing from their community supports. We also know that there can be a lot of stress, obviously, in families. There's unpredictability. So unpredictability not just for the youth, but in terms of how the family may respond to the youth's behavior. There could be safety concerns. So whether they're just trying to keep the child alive or feared for the child's life. Sometimes we know there tends to be a breakdown in communication sometimes. In some cases, we know that there can be legal issues. So in cases where, there's theft or things like that, the family may feel as a last resort, to try to get the child to change behavior. They may want to charge the youth or things like that. So there's an added, system and an added stress with the legal system. And I think for new settlers, this again, adding to their own post-traumatic stress and, their own past trauma and things like that, this is just an added layer that, they have to deal with. So challenges for families. So other challenges that family may witness. So even when the youth is engaged in treatment and the families are engaged in treatment, we do see that there's some other challenges that emerge. So it could be things like, they see setbacks in recovery because we know, recovery is not a linear process, right? There are ups and downs. They can view those setbacks as problematic. We know that often families struggle with the speed of recovery. So they want recovery to be faster. They may have unrealistic expectations. And again, Vince talked a little bit about managing expectations. So it's really important, to help them understand what recovery means, what that process could look like. We know that sometimes, they definitely, this is a big one that does come up in our service quite a bit. They struggle with consent and confidentiality laws that we have here, in Canada. I know for myself, a lot of new settlers, we don't have those same laws back home, right? And those laws look differently. So for them to come into, a service and say, well, I can't share that with you, because this youth is, 18 and, they're saying that they don't want, that can be really hard and really challenging for families. And that leads to them often feeling, lack of information and knowledge about treatment. They feel like they're in the dark. They go through a range of emotions, and Vince talked nicely about that one in his presentation. They themselves might be receiving little supports, right? So they're busy trying to support these young people and just manage life in general. So, often we hear for families, I don't have time. I don't have time to come in and talk to you, about my own issues, but, I just want my kid to be okay. And we know that often another stress for them is, often they have to change the way they're relating to their youth. And one analogy I like to use is this idea of parenting a tulip in a rose garden, right? And we often say to parents, it's not that, what you're doing is not working. It's just, you've parented other kids, yes, they are successful kids, but for this particular kid, they need something different, right? So they're both lovely flowers, roses and tulips, right? But the idea is that they need different things. So what are some best practices in terms of treatment for concurrent disorders? So we know that concurrent disorders, it's more likely to be effective if we match youth with where they're at. So not just with the appropriate service, but in terms of sort of meeting their needs and their goals. We know that treatment is most likely to be effective too if we treat for extended period of times, right? So we often say that, it's taken this long, for them, they've been dealing with these challenges for a while. It's not going to go away overnight, right? It's going to take time to kind of resolve. We know treating concurrent issues, it involves family and treatment, holistic, and one of the things I would like to add to that is also culturally sensitive. So we know that treatment is more likely to be effective if we consider all of those factors. And then we have some sort of relapse prevention plan. And I think for me, the most important thing in this is also that therapeutic relationship and therapeutic alliance, because I think without that, right, like it's hard to do any of the work that we do. So some approaches that we find helpful. So really understanding the youth's perspective, sort of where they're at, and you know, again, don't make any assumptions. Like as Dr. Payne says, like start with the knowledge that I don't know, right? And don't make assumptions. So just clarify and check in, use your active listening skills. Validating their experience, so validating why they're here, how they feel about coming into treatment. Establishing their goals, developing an understanding of, their language, and then reflecting, that language in our treatment plans and our discussion with youth and their families. So evidence for family involvement. So what we see is that when families are involved, we see higher engagement and retention for the youth that we work with. We just see overall, benefits to their well-being, reduction in substance use. So partnering with families. So one of the things that we know that it's really important that, to incorporate the family's vision in terms of the work that we do with the youth. So taking into account the family's goal and what their hopes and wishes are for the youth, help them develop an understanding of the youth's goals, because often what we know is families are more ready for change than the youth are. So sometimes we really, they're way ahead, right? And the youth's just over here and has, so really trying to help them bridge that gap and help them understand that process. Assisting them in contributing, to the youth's goals so that it's not just the youth, but, their perspective are taken into account. Managing conflict situations, supporting them to manage conflict situations. And I think the biggest thing in any kind of family work is really trying to find that middle ground, right? So that the families are feeling like their perspectives are heard. And just some general tips and strategies that have been helpful for us in terms of some of the work we do with the families that we work with. So kind of really highlighting the difference between educating versus scare tactics. Many of the families, like I can't tell you how many youth I've said, well, my mom had told me, like if I use this, I might die, right? And we know that that's not effective, right? Because a lot of times you'd often say, like, I'm just more curious, right? It makes me want to do it more or use more or whatever the case may be. And then just encouraging them to really discuss issues together. Communication, so as I said earlier, we know there's often a communication breakdown. And when families are going through these stressors, it's not the time for less communication, it's the time for more communication, right? But effective communication. So really teaching families, how to communicate and helping them communicate around these issues. So things like I statements, appropriate times, when to address issues, and really validating each other. Being empathic, so it's not the time when conflicts are high, right? It's hard to be gentle and kind to each other, so remembering and reminding them of that. Really talking about parenting style, so obviously the idea again, tulip in a rose garden, so when to be authoritative and not necessarily authoritarian or too permissive. And self-care and managing emotions. And again, Vince talked about this in his presentation. So really, families taking care of themselves, And again, another analogy that I think of when I say that is, for how many of us, whenever we go on an airplane, they always say, if you're traveling with a young person and something happens, you've got to put the oxygen mask on you first before you tend to that little person, right? So it's that idea, if they're their child's biggest advocate, and they need to be around to be able to support their child. So they've got to take care of themselves so that they're there to help them go through recovery. And then last but not least is accessing their own supports if they need it. So that's it for me. Thank you.